Hi, my name is Isabella Concepcion-Sagarati, and I'm a medical dosimetry student at Thomas Jefferson University. As someone who came into medical dosimetry strictly from a biology background and no radiation experience, I would say my biggest learning curves were radiation physics concepts and cross-sectional imaging. I did have some prior physics courses during my biology undergraduate years, but nothing was radiation specific. I do think what I struggled the most in the beginning was understanding the different interactions of ionizing radiation, but I took the time to review my notes, read up more, and definitely I would say sometimes making visuals can help understand concepts. Just breaking it down and seeing what's going on can just paint a picture better in your mind to help you understand. And I would say in terms of anatomy and physiology, I did take these courses prior to being accepted into the program, but everything was based on anatomic models and some histology. Nothing was anything on like CT scans or any diagnostic imaging. I did have some prior shadowing experience in my former job, so I was able to shadow CT, X-ray, MRI, and PET, and I was able to observe how patients are set up and how each modality's images appear differently. So I did learn a bit back then about like Hounsfield units, but I do think when I started the program, just learning cross-sectional was a whole different ballgame. But I would say the more you practice and contouring itself, like I any free time I had in the start of clinic, I spent a lot of time contouring and a lot of time studying my cross-sectional, and that helped me a lot to become more familiar with CT scans. So I would say those two things were a major part of my transition from biology to medical dosimetry and learning more about the radiation sciences. And I think anyone who may not have had radiation experience um, has the potential to do very well in this field if you're interested in healthcare. And I was glad even though thought like it was daunting at first, I took this step and believed myself, and I did it, and I'm almost done with school. So I couldn't have asked for better experience and excited to start my future in medical dosimetry. And I'd like to just end saying thank you to the AAMD Foundation for awarding me one of the Varian student scholarships and an MDCB exam voucher. I am so honored to be awarded as one of their donees for 2025. Thank you.